In this IDP camp, the women are lacking health education. They need infrastructure here to take care of their babies because their babies are dying. With lack of hospital, the babies are dying due to some diseases like diarrhea and vomiting, malaria, and pneumonia.
The Unicef report on death of newborn babies has it that globally, in low-income countries, the average newborn mortality rate is 27 deaths per 1,000 births. In high-income countries, the rate is 3 deaths per 1,000 newborn. It states further that the world has more than half the number of deaths among children under the age of 5 in the last quarter century, lamenting that progress has not been made in ending deaths among children less than 1 month old. The Executive Director, UNICEF, Harrietta Ford, stressed that the majority of the deaths are preventable, which clearly shows that stakeholders are failing the world's poorest babies. The report notes that 8 of the 10 most dangerous places to be born are in sub-Saharan Africa, where pregnant women are much less likely to receive assistance during delivery due to poverty, conflict, and weak institutions. With the newborn mortality rate of 29 deaths per 1,000 births, the global estimate ranked Nigeria as the 11th highest on newborn deaths. In the recent Multiple Indicator Cluster Survey, MICS, conducted by the federal government in 2016 and 2017, the rate of newborn deaths per 1,000 births is 37. This national average conceals the difference between the 36 states and the slow progress in some of them. On chances of survival, the UNICEF Nigeria's representative Mohammed Fall recommends that Nigeria's children should begin with a strong, healthy start, but lamented that many children in Nigeria are still deprived of healthy start. Mr. Fall says the MICS data tells stakeholders that the trend is improving, but urgent action needs to be taken for Nigeria to reach the Sustainable Development Goals. He says more than 80% of newborn deaths are due to prematurity, asphyxia, complications during birth, or infections such as pneumonia and sepsis. These deaths, according to him, can be prevented with access to well-trained midwives during antenatal and postnatal visits, as well as delivery at health facility, along with proven solutions like clean water, disinfectants, breastfeeding within the first hour, skin-to-skin contact, proper cord care, and good nutrition. A shortage of well-trained health workers and midwives, according to him, means that thousands doesn't receive the life-saving support they need to survive. UNICEF also issues an urgent appeal to governments, healthcare providers, donors, the private sector, families and business to keep every child alive. To successfully do this, UNICEF recommends recruiting, training, retraining, and managing sufficient numbers of doctors, nurses, and midwives with expertise in maternal and newborn care. Joseph Kadri, ITV News, Abuja.